Hey everyone, and welcome to another episode of Dentistry Unmasked. I'm Pam Maragliano-Muniz, and with me as always,
Hey, Pam. David Rice. Welcome back, gang. Good to see y'all here.
so happy to have everybody here. I am so excited for this week because we're talking about one of my favorite topics ever with a dental hygienist, Kelly Overton. We're talking about how to boost the hygiene department, how to leverage your hygienist, how to boost profitability in there. So, Kelly, tell us a little bit about yourself and let's talk about how we can help our dentist friends out here do better for their patients and their practices.
Hi there. Thanks for having me. I'm excited to be here. I live in Northern California. I have been a hygienist since 1999. And I've worked for the same practice for about 20 years. I left for 5 years, came back, and now I am doing clinical hygiene a few days a week. And I'm also doing support for the hygienists and mentoring. So it's been a great ride.
Very
That is
cool.
so exciting. I love that. So, I feel like so I graduated hygiene school in 98 and then I got my bachelor's in 99. So I feel like I've been at it the same amount of time as you. And I feel like, I don't know, with the more years that go by, the more I enjoy seeing my patients because I feel like the relationship starts to get developed and you really have a legit relationship with your patients. And I think it took me some years to realize the impact that we can have on our patients' well-being and on their health. And I feel like it took time for me to get there.
hmm I agree, Pam. I love my patients. I love being in clinical, but I also love being with the hygienist and really being there to support them, bring on new products, talk about things that we can do better in the hygiene department. So that's been a really crucial role for me, and I just really have been enjoying it.
Where do you see Kelly? Because you have your own experience, and then you have this experience where you're in and out of practices, and you meet lots of people, and you hear lots of stories. Where do you see the greatest opportunities? Like you walk in and you're like, oh gosh, if we only do these one, two, three things, patients are going to be so much healthier, and the practice will be healthier as well.
Absolutely. I think one of the keys is assessment. Really looking at the person as an entire body, not just a mouth that's sitting in your chair. There's so many studies that are coming up. All the research is just coming to light. The public is starting to see it. They're starting to ask about it. How is my body related to my mouth? What about the bacteria? So we're finally getting these questions about the oral systemic link. When I started learning about the oral systemic link, it was about 7 years ago, and it was like talking to your patients in a foreign language. They had no idea what I was talking about. They would say, really, the bacteria in our mouth gets into our bloodstream and it can go through our whole body. And now it's pretty much coming mainstream, which is super exciting to me. They are asking about it, wondering what they can do. So they're more preventative based, which is really great. So that's been the greatest thing for me as a hygienist.
I frickin' love that. And it's so true because I feel like it's taken time for people to realize, which seems crazy, that the mouth is connected to the rest of the body. I mean, go figure. And the other thing about it is that it's so common. There are 57 systemic illnesses that are exacerbated by oral inflammation, and it's the common ones, cancer, heart disease, diabetes, dementia. Like there's so many out there. And I would argue that everybody either has themselves or is related to somebody who has one of those 57 systemic illnesses that's exacerbated by oral health. And for me, that's such a huge opportunity for us as oral health care providers to get and keep our
Right.
patients healthy and do our part to mitigate that risk.
That's right. We're no longer tooth janitors. We're oral healthcare providers. I mean, that is wonderful. That's something that's been the biggest change in my career. And it's really increased the longevity of my career and really excited and ignited me again about the why. Why am I doing this? Because sometimes, honestly, being a hygienist can be mundane. So you're doing the same things over and over again. So when you really start looking at your patient as a whole entity and what can I do for this patient to make them healthier, what kind of modalities do I have at my fingertips that I can help with their disease progression? If we're not preventing it, then we are treating it. So we want to be in the preventative mode. I want to give them everything that I have in my toolbox to help them and prevent it, whether it's gingivitis, whether it's periodontal disease, whether we're working with lasers or Perio Protect or antimicrobials. There's so many things. And if I'm not letting my patients know what is available to them, I'm doing a disservice for my patients.
Mm.
I couldn't agree more. So you mentioned a few of the modalities that are out there, and I feel like I have to say this because I like my soul's making me say this. We're not, hygienists are not tooth janitors. If you choose not to be a tooth janitor, because there are tooth janitors out there. And I feel like now, especially now as a practice owner and, talking to our friends, we actually had a conversation with somebody, right, David, with a dentist in the Midwest who was saying that it's going to become, we're going to get to the point where dentists cannot afford to have hygienists in their practice, which if he's correct, that's devastating. It's devastating for patients. It's devastating for the profession of dental hygiene. It's devastating for a dental practice. And so we have an opportunity to step it up. And I feel like, especially with the different wage demands that are out there, and I know different states, it's different. We have to leverage ways within our practice to become profitable so that the practice can support the hygienist in the way that they deserve to be supported. But being a tooth janitor and demanding the highest wage you can get just because you can, that's not the way to do it. And it's not going to keep you in a practice over the long haul. It's not going to happen. So I feel like we have these different modalities to get and keep our patients healthy. And my favorite part about it is it's a win-win for everybody. It's a win-win
Right.
for the practice, and it's a win-win for the patient. So would you kind of I don't know, let us in under the hood a little bit and hear about some of the tips and tricks that you share with hygienists to get them, to really elevate their game?
Mm-hmm. Since I am a practicing hygienist, that is very helpful for me because I have my boots on the ground. I'm really in there. I know what the other hygienists are doing. I know what's required. And so I really come at it from that point of view. I'm in it with them. And what you talked about is really important. We're entrepreneurs of our operatory, and that is really important. What happens in that operatory when that first patient walks in, we're really diagnosing with the doctor in conjunction with them and really looking at this patient as a whole person. And I think that that's so important in the assessment phase of it because I feel like for me, I'm selling health. That's what I'm doing. I really want to let them know what we have available for them to keep them as healthy as we can, as long as we can. And even if it's just, gingivitis, which, I've been doing this for 25 years. So most people are not alarmed when they're bleeding. And so really just educating them about, are you concerned about this bleeding in your mouth? We have so many studies now that has linked this oral bacteria to whole body health. And I constantly am talking about, the link between the oral systemic in your mouth and the bacteria and the bleeding and the bacteria is entering into your bloodstream. And so the education key of this is so important. And when you are educating them, we know that they usually want something. What can I do? And we have so many new things that are available to us. So just really educating them on what's available. I don't feel like I'm selling them things. I feel like I'm just educating them on what's available and what I would do for, my family member or my husband, whether it is using Perio Protect, which we do in our office, which has been amazing. And also we use lasers, we use antimicrobials. So we really try and come at our patients with everything that we have to get them healthy. whether it's preventing, patients that are coming in with a perio maintenance appointment. So they've already been through scaling and root planing. They may have already seen the periodontist. And we're really just trying to prevent them from it getting more aggressive. And so I let them know we have a new product in our office. It's not new. It's been around since 2005, and it's called Perio Protect. And I will let them know what a great product this is. I mean, it's a game changer. I've been doing this for a long time, and it's been a game changer for our office.
Can we talk more about that? Because I feel like there's two practice prototypes out there. One, I love Perio Protect. Two, I don't know what that is. And I really clearly, when we're in camp one, we know better. So how do we help those who aren't familiar really grasp what's possible?
Well, the first key is getting the assessment. What are we looking at? We're diagnosing, we're seeing if they have any recession, if they have gingivitis, what their probing depths are, how much bone loss do they have? Do they have past treatment of periodontal disease? Do they have a high cavity rate? Do they have lots of crowns and fillings? Do they have implants? So you can piece all of these things together like a detective to see what is actually happening in their mouth. And for me, Perio Protect, I try, we only have an hour during that appointment time. So I really try to keep it short, but really let the patient know what is the best treatment for them. And so let's just say that they have, gingivitis, they haven't had any deep cleanings or anything like that. And so we'll go through their gum health. And I always let them know when we begin what I'm doing when I'm assessing them so that they are engaged in what I'm doing. So they know what the numbers mean. And you would be really surprised how many of the patients have no idea what we've been doing if we're not saying it out loud. And so I start by assessing their gums. I'm going to do a test on your gums. 2s and 3s are good numbers without any bleeding. 4 millimeters means gingivitis. It's inflammation in your gums, but it's reversible. 5 and above is periodontal disease, which is bone loss around your teeth. And so we set it up that way so that they're listening, they know they're part of what's happening. They can ask questions afterwards. I always go over things with them, but the assessment part is really important, depending on what modalities we're going to go from there. And Perio Protect trays is one of my favorite options because it is an at-home treatment. And as a hygienist, that's really been the missing link for me. We can do all of this acute things. We can do scaling and root planing. We can use lasers. We can do antibiotics. But as soon as they're leaving the building, the bacteria is coming back. And we know bacteria is the problem. So having that at-home device has been a game changer for me. So what Perio Protect is, it's a plastic appliance that's FDA cleared, and you wear it. It is custom made for your teeth and gums. So we send out the assessment, the probe readings, where the deep pockets are, where there's bleeding points. We scan their mouth. We send that scan out to Perio Protect, and they make a custom fit tray that fits their teeth and gums that they put a hydrogen peroxide gel inside of. And so it's essentially they are soaking their teeth and gums in a hydrogen peroxide at home between their visits. And that's the key to Perio Protect.
It's interesting too for a few reasons. Number one, I don't know what they put in it, but the gel is kind of delicious. So patients like how it tastes. So I feel like there's things we recommend that really aren't that pleasant, but it
Right.
is pleasant and they really enjoy it. And the beauty in the trays is that it's not something you can make in your practice. They're designed in such a way that they push the medicament below the gum line, and it can reach up to 9 millimeters subgingivally, which is incredible. And then again, we recommend these things, and oftentimes like there's a side effect that they might not like, but the side effect is that their teeth are whiter. So we can even tell as clinicians if they're being compliant with it because they're going to have whiter teeth. I feel like it's so rare to have something that has all positive side effects and, a positive experience versus, some other things out there that are, they hurt, or whatever, and they leave kind of a negative taste in the patient's mouth. So I don't know, like I use them in my practice and patients love them, and it's amazing that they will comply with it. And, I feel like not so much anymore, but back in the day, I was always nervous to bring something new into the practice. Like I wasn't sure how patients would receive it, or patients that have been patients for decades in this practice, trying to, how they would perceive something new, or, isn't what I've always had good enough? And, I definitely don't share that sentiment anymore, but it's amazing how people rise to the occasion with education, and people want to be healthy. I
Right.
feel like we sort of always accepted a level of malady in our patients' mouths for such a long time, and we don't have to do that.
No, there's so many preventative measures. And, with Perio Protect, having them able to do it at home between the visits, because, being a hygienist for a long time, we have the perio maintenance patients that come in, and we know they're doing the best job that they can do for the areas that they can reach, but they just can't reach deep inside those pockets. So they've got 3 months where that bacteria is accumulating. And so that's such a key to this, because I feel like as a hygienist in the past, I took it more personally that maybe I didn't educate them enough. Maybe I wasn't doing enough for them, not doing enough of a good job, or the patient felt guilty that, I'm doing everything that I can at home. I'm brushing, I'm flossing, I'm doing all of these things. And a lot of time their mouths are so clean. And so when you look at it from a different perspective, that it is bacterial driven. And so if we can keep that bacteria off of your teeth, or at least less bacteria on a daily basis, it's a game changer. And once you've seen the results with Perio Protect, you cannot unsee them.
I think both of those are like really strong points, and dentists who are listening, um, circle back to that. Your hygienists feel guilty when our mutual patients aren't getting healthy, when we all know that there are a lot of things that are out of our hygiene team's control, just like they're out of our control on the
Right.
restorative or surgical sides. And then on the patient side, same frame is, listen, I know you're doing everything right, but you got dealt a bad hand of dental cards. And the cool
Yes.
thing is we've got a way to help you. So the guilt factor just gets removed.
It really does. And then, as far as bringing on new things, the world's constantly changing. They're constantly doing research, and you have to stay up with the times. I mean, I wouldn't want to go to a dentist or a dental hygienist that were not staying up with the times. They're still doing the same thing they did 25 years ago. So I want all of the new information. What can I do? Is there anything else that I could be doing at home? And there's so many different things that we can give them as far as nutrition, Perio Protect, lasers. There's so many different modalities that we can offer them now. And that's just been such a great gift.
I think another thing is my hygienists love scanning. And so I think that, so we, when a patient decides they want Perio Protect or a night guard, or, whatever we're doing that, historically, the patient would have to come back for an impression appointment. We roll the scanner right into the hygiene room and the patient gets scanned. And it breaks up the hygienist's day. You mentioned earlier about the monotony
Mhm.
of the hygiene appointment, or at least the historic hygiene appointment, but it doesn't have to be that way. And so that's fun. And I feel like this way, the hygienist is part of the solution. It's not, oh, I found this. Now go see the dentist who's now going to make this thing for you. The hygienist is part of this. And I think that that's really important. But I'd like to bring up another point, because yes, a lot of things are about the hygienist, and I love hygienists. We don't know that. But let's talk about dentistry. How many people like to see their work fail? And nowadays, with implants, the level of sophistication on some of these prostheses are really great, and they make, the technology is there, and we can make all these restorations for patients, but inevitably they're harder to clean. And
Mhm.
so we maybe need to be thinking about the maintenance plan that's part of our restorative treatment plan, right? Because nowadays, just restoring a mouth and just saying, okay, well, I'll see you when you come back for hygiene. And I'm going to do, we're going to perform the same things that we've always done on you when you had teeth versus now you have all these implants. It's not really appropriate. And I think we should be thinking about maintenance when we're thinking about planning, even restorations.
Oh, absolutely. especially implants. I mean, we all know how hard those are clean as a dental professional, let alone at home by yourself. And so, I just explained to the patient, you've put a lot of money into this. They look amazing, but you can also get periodontal disease around your implants. That's the biggest failure rate. And so having Perio Protect trays is like having insurance. You really want to protect the investment, whether it's an implant or crowns, bridges, things like that, that it kills the bacteria that causes cavities as well. We're living longer, so there's more recession. So there's more root exposure. So it's part of our treatment planning, and that is how we treatment plan for implants in our office, and also periodontal disease as well. We use it for, I believe anyone would benefit with less bacteria. So I believe Perio Protects are for everybody. So
Yeah, I can't tell you how many patients we've had over the years. And Pam, I'm guessing you've seen this too. Like they're healthy, they're healthy, they're healthy. And then they hit this like age, they're medically compromised. They've done a good job, but their dexterity goes a little bit. And all of a sudden they fall off the cliff.
yeah,
And everything that we've worked so hard to help them with and everything they've worked so hard at home to prevent, it just in an instant, if we don't start thinking differently, behaving differently, and getting more prevention minded with a different level of prevention than we have in the past.
absolutely. I work in Northern California, and we have an office, A Plus Dental Office, through Smile Brands is the corporation. And we have an office inside Sun City, which is a 55 and older community. So we have a lot of elderly patients, and a lot of medications. So a lot of dry mouth, a lot of recession. So there's so many things that are hard for them. Also, arthritis, trying to get in there. So we really try and hit prevention with those patients as hard as we can, because we know prevention is the way to go. Because if we're not preventing, then we're going to have to treat it. So the most conservative approach is to prevent. And so I'm very proud of that. And Perio Protect has been an amazing part of our armamentarium to really help these patients long term.
Yeah.
I agree. And it's interesting. I mean, medical conditions is one thing, but I even find life events, it's a marathon, not a sprint. You could get somebody healthy, zero bleeding points, and then they're caring for a family member who's sick, or they lose a family member, or something happens where all of a sudden what they're doing at home is just they fall off the wagon a little bit. And so now things are different. And so then we can get them back to health. But if they have tools that are at home that are providing more benefit, then, hopefully they can make it through these ebbs and flows in life in addition to their medical conditions as well. And I love that you said everybody can benefit from fewer bacteria in their mouth. And that is just so true.
Absolutely. Yeah, I really do believe that. And so I just try to get that across to my patients and really just try and educate them on what are the things that we can do, using electric toothbrushes and all the things that we've been talking to our patients about for 25 years, So it's an exciting time in dentistry for sure.
It is, and I think people to this is very conversation, and I would say myself included, but most people like show me what to do at home as opposed to selling me something that, some service that you have, that's a we are in this thing together, as opposed to it's us as a professional versus the patient, which I think, a lot of people are a little bit skeptical. So when we give our patients the ability to take care of themselves and then come back in, isn't it so much more fun when they come back in and we're like, oh my God, you look amazing.
It is.
Like,
It's crazy.
just keep doing what you're doing. This is working. Those are my favorite days, when you start stacking multiple patients and you're like, just keep doing what you're doing. This is great.
I
Absolutely.
always ask them too, do you notice a difference?
Yeah.
It's one thing for us, because, I'll walk in and be like, oh, what's going on, whatever. And then, if I say, oh, well, how are your teeth? How is everything in your mouth? They're like, I don't know, ask Sarah, and I'm like, all right, well, well, but from your perspective, has anything changed or whatever? And they're like, no, everything's fine, but she'll tell you. And I'm like, okay. But, when we see an improvement, I always ask, do you notice a difference? And inevitably, they're like, I do. And I can't believe that this is how I feel now versus how I felt before. And I feel like getting their perspective on it, it's no longer just about the probing depths of the bleeding points or the report card they're going to get from their hygienist. They notice a difference too. And I feel like that also lends itself to more compliance at home.
Absolutely. And compliance is definitely the key. And Perio Protect, 99% of all patients long-term love Perio Protect once they have it, so it's got a really high rate for patients that are using it. But compliance is definitely key. But a lot of times you're getting these periodontally involved patients that are already on board and they're really looking for something. What else can I do? And offering something that they can do at home has really been the golden ticket for me. I just have really enjoyed being able to give them something that they can do between visits.
It's true. Now, let me ask you. So I know we're talking about Perio Protect, and maybe there's people who are listening that are like, "Oh yeah, I love that. That's great." I think we should talk about the practice and what it does for the practice from the standpoint of profitability and what that looks like. Because I think that, sometimes people are like, "Yeah, yeah, but I can't bring another thing in," or whatever. I feel like, in my opinion, from the standpoint of health, like we can't afford to not offer something that's going to get our patients healthier, but it also does benefit the practice.
Mm-hmm. Yeah, I mean, there's so many things that will benefit the practice, the patients, the hygienist. Just looking at it as you have to, as a hygienist, before we just really looked at it as cleaning off calculus off of their teeth and doing some education like electric toothbrushes and things like that. But we know now that it is a business, is the bottom line. And we do need to get paid for what we do, but we also need to keep the lights on and, the practical things that it makes a dental office run. And so for me, I assess the patient and I let them know my professional opinion, what would be the best treatment for them. Because if I'm not letting them know what the best treatment would be for them, then I'm not doing my professional obligation to my patients. And so I don't feel like I'm selling anything besides health. I feel like I am educating them, letting them know what is available. And all of these things are such a win-win for the practice. The patient is winning because we're killing the bacteria. So there's so many different things that we can do. And it's also helping our careers. It's elevating our careers. It's elevating what we do, really educating people, letting them know how educated we are as a registered dental hygienist. I don't think a lot of people really realize that. So it's just an exciting time for, I believe, dental just as a whole.
So Pam, I know we're like getting to the finish line, which is crazy to me because I felt like we just started 10 seconds ago, but you went through, in the very best way, an amazing transformation over the last several years in your own practice. And I know you're a raving fan, of lots of the modalities we're talking about now, Perio Protect being one of them. But like, what has it done for you?
What has this done? I feel like it's given me confidence as a dentist and as a practice owner that I know, like it's not even up for discussion. I know that we can get people healthy. It's not about, oh, let's see how they look this time. Like if you're willing to follow protocols and you're willing to do what you need to do at home and let us do what we need to do here, and we have a successful partnership, I know we're going to get you healthy. And we are going to do our part to mitigate that link between oral health and systemic health. Like I, in like my whole heart and soul, believe that we can get people healthy. That's number one. Number two, I feel like as a restorative dentist, we've all done it, right? We've all done the bloody composite. We've all done the bloody crown insert. We've all delivered anterior crowns, praying that there's no blood underneath that prep so that the whole thing turns brown. We've all done that. But I don't do it anymore. And so I will not initiate a restorative plan unless my patient is periodontally healthy. The only time I will do something is if it's caries control and there's a really big caries lesion that I need to address and I can't wait. But even then, I'll be like, let's start scaling and root planing in that section first so I can get to that. But I would absolutely never initiate an aesthetic case ever again on somebody who's not periodontally healthy because number one, I don't want to deal with it. I want to have predictable outcomes. I want to have predictable margins. I want to have my patient be pleased throughout the process. I don't want to do bloody impressions. I don't want to do any of that anymore. And we don't have to. And so I feel like I am so confident in the fact that I know we can, with via the partnership of my hygienist and the patient, it's not just me anymore on this island by myself. You know, I'm a partner with my hygienist and my patients bounce back and forth between me and hygiene throughout their entire plan. And what that's done for my practice is, I mean, we get so many new patients from word of mouth. We've got great Google reviews. Patients are so attached to my team. It's not only like they know me and they don't really know anybody else. Like they literally know every person in my practice by name because there's a relationship there and it's really based upon caring. And I don't know. I feel like just I could go on and on and on, but I guess if I'm going to like too long didn't read this answer, I'm just so much more professionally rewarded in every single way.
That's the perfect answer. Kelly, so all right, how do people get a hold of you? How do they learn more? How do we get better at what we do already in our practices?
I am based out of Northern California in the Sacramento area. I work for A Plus Dental Care. It's part of the Smile Brands Corporation. And, you know, I think just really looking at it is investing in your patients and they'll invest back into you. And that's really what they're looking for. They're really looking for your professional opinion on what they can do to elevate their care at home, elevate their hygiene, all of those things. So they're really looking for us to guide them. And so I have a great partnership with our doctors. We do wonderful exams with each other. And I love how you two really are supporting your hygiene department because it wasn't always like that, honestly. And so it's such a great shift. And I'm just really lucky to be a hygienist.
I love that. Well, we'll be sharing a link in our show notes to check out Perio Protect and learn a little bit more about that. I know we focused on that a lot today, so we'll make sure we get you that information. Kelly, thank you so much for joining us today. I really enjoyed this conversation. And to everybody out there, thank you so much for listening. And we will see you all next week on Dentistry Unmasked.
Thank you so much.
Thank you, everyone, for watching or listening to the show this week. And thanks to our guests and sponsors on this episode.
Please check out our social media at Dr. Pamela_Maragliano and at Dental Economics Official.
Or you can check me out at Ignite DDS or at Dr. David Rice.
And go to dentaleconomics.com to receive dental economics. You can choose to receive DE in print or digitally, and you can also get the details of our Principles of Practice Management conference on our website.
If you have topics or guests or anything you'd like to talk about on the show, send us an email to dentistryunmaskedpodcast@gmail.com, and we will do our very best to make it happen. Thanks again, and we'll see you next week.